Now, if you're turning 65 or just want to learn more about Medicare, then this video is for you. Stay tuned. Hi, this is Andrew with Medicare Screen Share. Now, we created this video so you could become an expert on Medicare and also so you can feel more confident when you are enrolling into Medicare for the first time. Now, let's get right to the presentation because this information is very important for you. Let's start with the basics and go over the different parts of Medicare. Now, Part A and B are what makes up original Medicare. Part A is your hospital insurance and helps cover you for inpatient stays at the hospital. Part B is your medical insurance and it helps cover you for services from your doctor. So basically, Part A pays for your room and board at the hospital, and Part B pays for the doctors and equipment they use. Most people enrolling into Medicare Parts A and B also get Medicare Supplement or Medicare Advantage policies to pay for the deductibles and copays of Part A and Part B of original Medicare. I'll be going over all these deductibles and copays of Medicare Parts A and B and those two different plan types a little later. Lastly, there is Medicare Part D. Medicare Part D, or Medicare Prescription Drug Coverage, helps cover the cost of prescription drugs you buy at the pharmacy. This is run by Medicare-approved private insurance companies, and you pay a premium to lower the cost of your prescription drugs. Next, let's move on to when you can enroll for these different parts of Medicare. So, if you are not already on Social Security or you do not have railroad benefits, you will need to enroll in Medicare within a 3-month window before you turn 65. This is considered your initial enrollment period. Now, some people might still be working and might be able to stay on their employer plan. If your plan at work has better coverage or costs less, then you may be able to delay enrolling in Medicare penalty-free. Next, with the Medicare Supplement, you can enroll up to 6 months before you turn 65. Enrolling early with your Medicare Supplement locks in your rates for up to 18 months and also locks in an agent much like myself as your advocate for the years to come. Lastly, with Medicare Part D, I recommend enrolling about 1 month before you turn 65 because you want to make sure your drug list is as up to date as possible because these plans have different costs based on the drugs you are currently taking, and we do not want you paying any more than you have to for Part D of Medicare. Here are the 3 ways to enroll for Part A and B of Medicare. The best way to enroll is just to go to your local Social Security office, but you can also enroll by telephone or online as well. Part A of Medicare is usually free if you and your spouse paid Medicare taxes while working, but there is a premium that you will need to pay for Part B of Medicare. The premium for Part B is $134 in 2017 for people new to Medicare, and this premium is either taken out by Medicare straight out of your Social Security check, or it is taken out by electronic funds transfer out of your current checking account. Now, before we get into all the different Medicare Supplement options, let's look at what original Medicare Parts A and B cover and do not cover. Here are the deductibles and copays for Part A of Medicare in 2017. With Part A, the most important deductible or copay you need to know about is that you need to pay the first $1,316 of your room and board at the hospital for each 60-day benefit period. You can pay this deductible more than one time a year if you need to stay in the hospital 60 days after you were last admitted. So your deductible is covered for 60 days and then it can reset. There are also 2 more deductibles if you spend more than 60 consecutive days in inpatient care, but it is rare to spend more than a few days in the hospital. Below are the deductibles and copays for Part B in 2017. The most important ones to point out here are the $183 deductible you pay before Medicare's 80/20 coinsurance kicks in. I'll give you a quick example. Let's say you get a bill for $1,183 from your doctor for the services he gives you at your last appointment. This was your first appointment of the year, so you will pay that $183 deductible, and also $200 for the 20% that Medicare Part B does not cover. Medicare will handle the other 80% or $800. You only pay the $183 deductible once a year, so you'll not need to pay that $183 the next time you go visit your doctor. Now, it is important to understand that the 20% that Medicare does not pay is unlimited, and if you get a procedure that costs $50,000, you would have to pay 20% or $10,000. Lastly, it is also important to ask your doctor if they take Medicare assignment, because some doctors can charge you up to 15% more than what Medicare is willing to pay for a test or procedure. Them charging you more than the Medicare assigned rates is called Medicare Part B excess charges. Now let's look at what else Medicare pays for. They cover your first 20 days in skilled nursing care. It will cost you $161 a day to stay in a nursing facility days 21 through 100, and then after 100 days, you are not covered by Medicare or your supplemental policy. This is where some people look at getting a long-term care insurance policy. You have to pay for your first 3 pints of blood. Blood typically costs $140 a pint, and Medicare covers 100% after your first 3 pints. Hospice care is practically totally covered by Medicare except for some small $5 copays on drugs and the 5% gap in respite care costs. And lastly, Medicare does not cover you outside the United States. Now, I know it seems confusing and expensive to just be on original Medicare, and honestly it is. But the supplemental policies we will talk about later cover most to all the deductibles and copays of original Medicare, so you do not need to worry about the majority of these Medicare Part A and Part B deductibles if you sign up for a Medicare supplement. Now the big question, should you sign up for a Medicare Advantage or a Medicare supplement to cover all to some of the gaps in Medicare? Well, Medicare Advantage plans are Part C of Medicare and are run by Medicare-approved private insurance companies, and they must at least cover what Medicare's Part A and Part B cover. Some plans even offer prescription drug coverage along with some other benefits. Now, Medicare supplements, as opposed to replacing your Medicare Parts A and B with another plan, work with original Medicare. Medicare supplements are designed to fill some to all the gaps in Medicare depending on which plan you choose, and these plans are also offered by private insurance companies. Okay, now let's discuss the differences between these two types of plans. Medicare Advantage plans usually have lower monthly premiums, with their most popular plans costing $0 on top of your $134 Part B premium. Medicare supplements, on the other hand, will run you about $70 to $130 a month, depending on your gender, zip code, and which plan you choose. Well, Medicare Advantage plans seem like a pretty awesome deal, but what's the catch? Well, we will need to look at what both of these plans cover in order to figure that one out. Okay, now the most popular Medicare Advantage plans have maximum out-of-pockets of $6,700. In comparison, Medicare supplement plans do not have maximum out-of-pockets, and you really never pay much more than your monthly bank draft. And yes, the $6,700 Medicare Advantage max out-of-pocket resets each and every year. Another negative with Medicare Advantage plans is that most cases you need to stay in the network of their hospitals and doctors. And if you go outside the network, your maximum out-of-pockets can increase to $10,000. In contrast, Medicare supplements have no network, so you can go to any hospital or doctor that accepts Medicare as payment. Medicare Advantage plans also require pre-approval for some testing and treatment. This can result in some loss in valuable treatment time. Supplements do not require pre-approval. Lastly, Medicare Advantage and Medicare supplement plans are structured differently. Medicare Advantage plans are yearly contracts that can change year to year, and you have rising premium, increasing copays, decreasing benefits, and the plans can even disenroll your area if it's costing them too much money. Medicare supplements also have rising premiums, but they are guaranteed renewable, meaning that you can keep your plan as long as you continue to pay the premium. They are also standardized by the government, so your plans cannot change year to year. So in summary, you get what you pay for with a Medicare Advantage. They do have better plans that have higher premiums and lower maximum out-of-pockets, but I just focused on their most popular $0 plans. Medicare supplements are simple to understand, and you usually don't have to pay much more out of pocket than your monthly bank draft. Now, I know I painted a pretty negative picture of Medicare Advantage, but there are good plans in areas of the country that are worth seriously looking at. But I mostly run into $0 plans where I market, so I'm going to focus the rest of my presentation on Medicare supplements because they have much more benefit-rich plans in your area. One more thing before I move on, it is important to point out that you do have to pay your Medicare Part B premium of $134 along with your premium for your Medicare Advantage and Medicare Supplement. Now, how do you compare the different Medicare Supplement plans? Well, there are 11 Medicare Supplement plans in most states, and all of them are standardized by the government. So a Plan F with one company has to have the exact same benefits as a Plan F from another company. It is also important to understand that different companies charge different premiums for the exact same coverage. So it's a good idea to check every few years to make sure you have the best rate in your area. Now here are all 11 options. All you need to do is look at the benefits on the left and see what each plan covers or does not cover. So as you can see, a Plan F covers everything, and a Plan G covers everything except for the Part B deductible. Now the three most competitive plans in your area are Plan F, Plan G, and Plan N. There are some cases where looking at other options is appropriate, but these three plans are what the majority of people will go with when enrolling into Medicare for the first time, and the ones I gave you rates for in the attached PDF presentation. So how about we start with the most popular plan there is, Plan F. Now, why is Plan F so popular, you ask? Well, probably because it covers 100% of the gaps in Medicare. So if you have a Medicare approved claim, your Plan F will pay anything left over that original Medicare Parts A and B do not cover. So it will pay for all the copays and deductibles of Medicare that we covered before. Now, because Plan F covers the most, it is usually the most expensive per month. For example's sake, I've included the rates for a 65-year-old female from Hebron, Illinois to show you how to compare these plans. And the cost of a Plan F for her would be $134.59 on top of her $134 Part B deductible. Next up is Plan G. And much like Plan F, it covers 100% of the gaps in Medicare, except for one thing. Plan G does not cover your yearly Medicare Part B deductible, so you pay the first $183 of Medicare approved amounts that fall under Part B of Medicare. Now with a Plan F, the insurance company pays that $183 for you, but they do charge you a convenience fee every single year to make this payment for you. You can see how much this fee is by just doing some simple math. So if Plan F costs $134.59 and Plan G for the lady in Hebron, Illinois costs $104.59, then the difference is $360 a year. Now we just need to subtract the $183 because you have to pay that Part B deductible instead of the insurance company paying it for you. So basically you are paying an insurance company $177 a year to write out a check for you. 99% of the time, Plan G is a better value than Plan F. The last competitive plan in your area is Medicare Supplement Plan N. Now, Plan N covers 100% of the gaps in Medicare with 3 exceptions. It does not cover your $183 Part B deductible or Part B excess charges, and you will also need to pay a $20 copay for doctor visits and a $50 copay for emergency room visits. So if Plan F costs $134.59 a month and Plan N costs $88.89 a month, you can do the math and see that the total yearly difference is $548 a year. So first, we will need to subtract the $183 Part B deductible from your difference because on a Plan N, you will need to pay that for yourself. So now the difference is down to $365.40. What else is different with a Plan N compared to a Plan F? Well, Plan N does not cover Part B excess charges, but those can easily be avoided by just asking your doctor if they take assignment. Oh yeah, the last thing different between Plan N and Plan F is that on Plan N you have a $20 copay for doctor visits and a $50 copay for emergency room visits. So in our example, this lady from Hebron, Illinois would need to go to the doctor 19 times or the emergency room 8 times in 1 year to make Plan F make more sense than Plan N. As a review, remember that Plan F covers 100% of the gaps in Medicare, and Plan G covers 100% of the gaps in Medicare, except for you must pay the one-time $183 Part B deductible. Lastly, Plan N covers 100% of the gaps in Medicare with 3 exceptions. It does not cover your $183 Part B deductible or Part B excess charges, and you will also need to pay $20 to go to your doctor and $50 to go to the emergency room. Now, everyone is a little different, and some people might like Plan F because it pays for everything. Others will prefer Plan G because of the savings you get by paying that one-time $183 yearly deductible yourself. And there are also other people who will like Plan N because they have no problem with paying $20 to go see their doctor and $50 to go to the emergency room. Now, to conclude the presentation, let's talk about the most popular pastry in Medicare, the donut. Now, a donut is used to represent how most drug plans work on Part D of Medicare. Now, every drug plan is different, but you can expect most drug plans to work a lot like this. First, you will have to pay a $400 yearly deductible before your plan pays anything. After that, you will need to pay a copay and coinsurance for your drugs. I've used 25% coinsurance in this example, but it is different from plan to plan and also from drug to drug. But to keep it simple, in this example, you pay 25% of the drug cost and the prescription drug company pays 75% until you and the insurance company have paid together a total of $3,700. This is where you reach the donut hole or the coverage gap. In this gap, you will be responsible for paying 40% of brand name drugs and also 51% of generic drugs. Now, when the insurance company and you have paid a total of $4,950, this is where you move into catastrophic coverage. This is where the government steps in and helps out you and the insurance company. You are only responsible for paying 5% of the drug cost from this point until the end of the year. Much like Medicare Supplements, there are different plans and companies to choose from for your Part D drug coverage. And signing up for Medicare Part D is as easy as calling Medicare or enrolling online. Now, it is important to know that these plans have covered drugs or formularies. These formularies are important because if you are taking a drug, then we will need to let Medicare know so they put you on the correct plan for the drugs you are currently taking, and also the lowest cost plan. It is easy to apply for these plans, and I will gladly help you through the process of finding the best possible plan for you because Part D drug costs vary greatly depending on the drugs you are currently taking. But it is important to know that we do not directly sell these plans or make any money off them. So you will need to go directly to Medicare to get all signed up. Now, if you made it this far in the video, I just want to take a quick second and thank you personally. I know it's not the most exciting topic, but you are one of the few who is really taking Medicare seriously. Now, feel free to send me an email if you want quotes on plans F, G, or N, or if you want a PDF copy of the presentation from the video. Now, my email address is medicarescreenshare@gmail.com. And as always, please like, comment, and subscribe as soon as this video ends so we can help more people.